Hi, I'm Dr. Stephen Stokes, Advanced Pain Solutions. I want to talk about headaches and migraines. So I treat a lot of migraines and a lot of headaches at APS. And my personal experience has been that they're very distinct types of conditions. What works for a headache won't work for a migraine and vice versa. In fact, a lot of what works for headaches makes migraine pain worse. And so the traditional headache that we see is a tension-based condition. In other words, it is from strain to the soft tissues of the body, whether it's the muscles or the fascia. And that strain usually comes from postural strain. For example, being in this position on your phone all day, or working in this position, or holding your neck in a certain position for a long period of time, like if you're driving in a car. That can cause some changes to the soft tissues, and those changes then can put pressure on nearby nerves and blood vessels. For example, the most common one we see is on the back of the head. Back here, we have two nerves. We have a nerve called the occipital nerve, and we have an artery called the occipital artery. And these nerves and arteries are close to that ridge on the back of your skull. When you get a lot of tension back here, it can compress those nerves and compress the blood vessels, and it can cause all sorts of symptoms and produce headaches. It can even cause visual blurriness of vision, pain around the ear like a question mark. All this comes from tension in that plexus of nerves. And so the way we treat that is very simple. We want to go in there and we want to lengthen those tissues. We want to bring blood flow into that area. Okay? So if it's ischemic, if there's been a lot of tension on a nerve and that nerve is being compressed and the tissues are being, tight, we want to bring blood flow into those tissues so they relax and get everything working properly. We use myofascial release techniques for that. And we also use something called vacuum massage, which is like, it's like a vacuum cleaner almost with a glass cup that we run over the tight tissues, and that will suck or pull the tight tissues into the cup as we move it. And it's amazing. It produces an immediate change in the ischemia. It lets blood flow go into that area, and it gently stretches and dilates the blood vessels. With repeated use over time, it actually causes vascularization of that area, so you're less susceptible to headaches in the future. It's a great procedure. That, along with manual, good old-fashioned manual myofascial therapies, work really good for traditional headaches. Even yourself, if you take your fingers and you feel your scalp and you massage your scalp like this and you slide the skin that's on top of the fascia over the scalp, that can even do wonders. If you just work sort of the area, it can do wonders for increasing blood flow, circulation, relaxing the tension, right? Moist heat works good as well. And that's your traditional headache. However, migraines are a completely different condition. Much more harder to treat, much more serious. Traditionally, people think that migraines are vascular, and I disagree. It's in my opinion, migraine headaches are not a vascular headache. Migraine headaches, especially the ones where people see these visual auras around things before the pain comes, this is a neurological headache. And it's what I like to call the brainstorm or the neurological storm. And it comes, I believe, from an overexcited sympathetic nervous system. So, your nervous system has a sympathetic and a parasympathetic branch. The sympathetics are the fight-flight, response. The parasympathetics are the rest, the digest, the relaxation response. And they're supposed to be balanced, like yin-yang. But if the sympathetics become overactive, overstimulated, then just basically your nervous system can get short-circuited. And your brain, the head, it just becomes, like I say, a brainstorm, just a storm of neurological activity. And I believe that's what migraine headaches are. So you need to not worry about the muscles and the fascia. If you have migraines, you need to calm down the sympathetic nervous system, relax that system. One of the best ways I find to do that is with cranial work. It's with taking the skull and reducing the pressure inside the skull. And we do that by applying specific forces to the head, and even by entering the mouth and going up to the top of the roof of the mouth, the soft palate. So like one thing, if you get migraines, that you can do that may help dramatically is if you just take your thumb and put your thumb, clean thumb, put your thumb in your mouth up to the top of the roof of your mouth, the soft palate, and you just apply pressure to that area like this, that has an effect of relaxing the sympathetic nervous system and calming down that brainstorm through cranial decompression. And there's many techniques. Most of them are too advanced to share right here. But at APS, I mean, we're skilled in this. We do this every day, and we get great results in patients with chronic migraine headaches by working with the skull and working to decrease the pressure and relax the sympathetic nervous system. So again, if you're suffering from headaches, you want to make sure that you have a good game plan for the right type of, for the type of headache that you have. Headaches versus migraines. If you have headaches, you want to definitely have a myofascia or myofascial approach. If you have migraines, you don't want that. You don't want somebody digging into your neck, digging trigger points out of your shoulders. If you get migraine headaches, it's just going to make it worse. You need to calm down the sympathetic nervous system, and some very specific cranial manipulation, cranial work, maybe even some internal cranial work can do wonders to finally calming that down and getting things balanced so that you won't have those reoccurring headaches. Lots of people say that cranial manipulation, it doesn't work, or not that it doesn't work, but it's not based on any reality or any science. That's completely false. We know now that there's pressures that can be affected through cranial manipulation. We know through Hilton's law that we can affect cranial nerves from manipulation around the ear and manipulation to different parts of the head. So it really works well, but you need somebody who's skilled in it. If you suffer from migraines or headaches, give my office a call. If you have any questions, just email me. I'd be happy to answer any ideas that you have or any things you need clarified on. And you're welcome to come into my office for a consultation. Let's find out which type of headache you have, and let's lay out a pathway to get you feeling better so you don't keep having these debilitating migraines or debilitating headaches. That's what we're here for. That's the passion, that's the work. We enjoy it here at the clinic. You'll see me personally. I do this every day, and it truly is what inspires me to get up every morning and go to work to help people, maybe like you, who have these conditions and they've just been through the mill. They've been everywhere with these things, people repeating the same things over and over again that don't work. Try something different. And